Good morning, everyone. Lecture number 1. Topics to be covered: the female pelvic anatomy. We're gonna go over the uterus, fallopian tubes, surrounding spaces, ligaments, and bony pelvis, ovaries, and the ultrasound appearance. Number 1, we are going to talk about the uterus. What is the shape of the uterus? It's a pear-shaped muscular organ. What are the parts of the uterus? We have 4 regions. We have the fundus. Look here, this is the fundus, the most superior part. And then we have the corpus, and then we have the isthmus and the cervix. Let's talk about each one in more details. I'm gonna write down the information in the board. So fundus. If you look here to the fundus, this is the fundus. This one is the fundus. The fundus is the widest and most superior portion of the uterus. More close. So widest and most superior. At the lateral borders of the fundus, this area here, at the lateral borders, we have something called the cornua. So this one is called cornua. And this one is called cornua. At the lateral sides of the fundus. Where is the fallopian tubes enter the uterine cavity? Look here how the fallopian tube enters the uterine cavity. Again, fundus, the most superior and widest portion of the uterus. This is the fundus area. And at the lateral side of the fundus, we have the cornua, where the fallopian tubes enter the uterine cavity. So this one we have fallopian tube and the other fallopian tube. The fallopian tubes enters the uterine cornua through the this area here. This is called the cornua. The fallopian tubes enters the uterine cavity through the cornua. This is for the fundus. Body. So I'm gonna erase this one. Body, this area here is the body. So number 1 is the fundus, and then we have this area here. This area is called the body. If you look here, this is the largest portion of the uterus. So this one, the body, or also known as corpus, this one is the largest part of the uterus. And within it, the uterine cavity. So this one will be the body. Look here, this is the body. The body is the largest part of the uterus, and within it is the uterine cavity. This is called the uterine cavity here. This is the uterine cavity. And the baby grows in the uterine cavity. And we have the baby will grow within the uterine cavity. This is for the body. So we have again fundus and we have the body. Fundus is the most superior and widest. Body is the largest part of the uterus. And within the body, we have the uterine cavity. Okay, next it will be isthmus. What is the isthmus? So it's the transition point between the body and the cervix. This is the point where the uterus bend either anteriorly or posteriorly. Isthmus. What is the isthmus? The isthmus is the waist of the uterus. Look here, this is the waist. This area here. This is the isthmus. The waist of the uterus is the transition point between the body. Look here again. It's a transition between the point between the body and between the cervix. This is the cervix area. This area here is the cervix. So isthmus is the waist of the uterus. And this is the transition point between the body and the cervix. And this is the point where the uterus bends either anteriorly or posteriorly. So remember, guys, the isthmus, you're gonna understand this one more when we talk about the uterine positions. The uterus may bend either anteriorly or posteriorly at the level of the isthmus. So the isthmus is the most flexible part of the uterus. Flexible is the most flexible part of the uterus. So again, we have the fundus. It will be the most superior and widest. And then we have the body, largest. And then the isthmus is the most flexible part between it's the point between the body and the cervix. Next, it will be the cervix. Which information we have to know about the cervix? Cervix is cylindrical, projects into the vaginal canal. The cervix has internal os opening, and this one from the cervix into uterus, and an external os opening from the cervix into vagina. So cervix. If you look here for the cervix is cylindrical in shape and cross-sectional. You're gonna see the cervix looks like that. This is the cervix. This is how the cervix looks like in cross-sectional. It's cylindrical and projects into the vagina. This one here, the vagina. Look, this is the cervix area. This is the cervix area. This area here, let me try to color it. This is the cervix. The cervix is cylindrical in shape, project into the vagina. So this is the vagina. And the cervix has two openings. We have one opening is called internal os, and the other one is called external os. Internal os, look here, this is the one, it's opening. This opening, internal os, from the cervix to the uterus. And external os, it's opening from cervix to vagina. Internal os, external os. This is the cervix. Do you remember when we mentioned the isthmus is the most flexible part of the uterus? The cervix is firmly supported, is the most fixed part of the uterus. It's fixed in position. It's fixed in position. It's not movable. This is the opposite to the isthmus. Why? Because it's held by two ligaments. Remember, for ligaments, if you know that the ligaments hold the organs in position, and we are going to talk about the ligaments and how the cervix is not movable, supported by two ligaments. It's firmly supported and fixed in position. This is for the parts of the uterus. We're gonna have like another information we have to know about the cervix. I'm gonna write it down for you. When the cervix projects into the vagina, four forenses are formed. Okay, guys, please pay attention to this one here. I'm gonna try to draw for you the cervix area to show you what are the four forenses. So look here, it said when the cervix projects into the vagina, four forenses are formed. What is the meaning of forenses? Forenses means spaces. We have fornix, which is the singular. Fornix means space. Okay, so look here at this point. This is the cervix. and this is like the vagina here. If I wanna like to draw like the uterus in side view, so this one is interior view and this one is side view. Okay, so look here guys, this is the cervix. When the cervix, see how it's cylindrical in shape again, and it projects into the vagina. This is the vagina. Okay, when the cervix projects into the vagina, we have four foranuses, four spaces are formed. What are the four foranuses? Look here at this one. I'm gonna like color it. Let's see. We have one space is formed here, and another space is formed here. So we have two lateral, one lateral and one lateral. We have two lateral foranuses. So this one, two lateral foranuses. And look here, this is the side view. We have one posterior and one interior. So we have this one, it will be interior, and this one, it will be posterior. So we have one interior and we have one posterior. The posterior one, it will be the largest fornix, is the largest space. This is for the parts of the uterus. So again, for the cervix, when the cervix projects into the vagina, we have four foranuses are formed. We have two lateral, and we have one interior and one posterior. Okay, this is the parts of the uterus. Let me. Next, in your slides, you have the layers of the uterus. Layers of the uterus. So we talked, guys, about the shape of the uterus, and we mentioned the shape is here. We mentioned the parts of the uterus. We have the fundus, body, cervix, and the isthmus and the cervix. Now we wanted to talk about the layers of the uterus. Repetition is good. You have to go over the information again and again, understand and memorize. So we talk about the fundus, most superior and widest, body, largest, isthmus, most flexible part of the uterus, cervix is firmly supported by two ligaments and it's fixed in position. It has two openings, internal os and external os. When the cervix projects into the vagina, four foranuses are formed. Next, it will be the layers of the uterus. Layers of the uterus, we have like three layers. From out to inner, we have the perimetrium or serosa, perimetrium, and also known as serosa. We have the myometrium, and we have the endometrium. So layers of the uterus, we have the perimetrium, this one is the outer layer, and myometrium, MM, this is the middle layer, and the endometrium, it will be the inner layer. Let's talk about one by one more details about each layer of the uterus. So number one, it will be the perimetrium or serosa. So this one is the outermost layer, which is part of the visceral peritoneum. So perimetrium is the outermost layer and it's a part of the visceral peritoneum. Do you remember what is the peritoneum? Peritoneum is a membrane lining the inside of the abdominal cavity. I think you heard about this one in abdomen. Peritoneum is a lining that lines the, or a membrane lining the inside of the abdominal cavity, and also we have visceral peritoneum, the membrane that surround the organs. So visceral peritoneum is a membrane that surrounds the uterus. Or visceral peritoneum as a general, it's a membrane surround the pelvic and the abdominal organs. So the perimetrium is the outermost layer, which is part of the visceral peritoneum. Okay. What about like the ultrasound appearance of the perimetrium? This layer cannot be visualized on ultrasound. So it cannot be visualized on ultrasound. Cannot be visualized in ultrasound. We will not be able to see this layer on ultrasound. What about the middle layer, myometrium? So this one is the middle layer. And is composed of muscle and the connective tissue. This one is the thickest layer of the uterus. The inner portion of the myometrium referred to as the junctional zone. Myometrium. Myometrium MM. This one is muscle layer, the muscular layer, and its middle layer. This one is composed of a smooth muscle tissue and connective tissue. This is the thickest layer of the uterus. And the inner portion of the myometrium is called junctional zone. And I'm gonna try to draw this one for you. Look, guys, this is how the uterus looks like in ultrasound. So look how it looks like. This is like the fundus. Remember, the fundus is the most widest and the most superior part. And then we have like the body area. And then we have, this is the cervix area. This is the vagina. This one, it's like a very thin echogenic line. You're gonna see it within the vagina. This one is the vaginal canal. Fundus, cervix. This area, it will be the body. And the narrowing area, it will be like the isthmus. And this one here is the endometrium. The endometrium, we are going to talk about the endometrium, which is the inner layer of the uterus. This is the endometrium. The endometrium, it should be like echogenic. The appearance, ultrasound appearance of the endometrium varies with the menstrual cycle. And we are going to talk about this one later in details. But sometimes you're gonna see like a hypoechoic halo. Look here, I'm gonna draw a hypoechoic halo. It's a hypoechoic halo, right? It's surround the endometrium. And this one is called the junctional zone. It's not part of the endometrium. It's the inner layer of the myometrium. It's the inner portion of the myometrium is called the junctional zone. So this hypoechoic halo that surrounds the endometrium is called the junctional zone. This is the junctional zone, the hypoechoic halo that surrounds the endometrium. So we have the perimetrium, we have the myometrium, and then the inner layer is the endometrium. Let's write down information about the endometrium. Endometrium, it's a mucus membrane that lines the inside of the uterus. The technique of endometrium varies with menstrual cycle. So the endometrium, it's a mucus membrane lining the inside of the uterus. The ultrasound, the appearance and the thickness of the endometrium, it varies with menstrual cycle, and we are going to talk about this one later in lecture number 3. So this is for the endometrium, the inner layer. This is the inner layer of the uterus. Okay, endometrium has 2 layers. Let me write it down for you. For endometrium, we have 2 layers. One is called the functional layer, and the other one is called deep layer. Other names for functional layer: superficial superficial layer, and this one is basal layer. This one zona functionalis, and this one is zona basilis. The endometrium has two layers. We have the functional layer or superficial layer, and we have the zona functionalis. So this is other names for the functional layer. We have the other layer called the deep layer, or other names basal or zona basilis. Both of the two layers, they have like endometrial tissue and the endometrial glands. Very important information you have to know about the functional layer or the superficial layer. This layer is the one that sheds with menses. This is the layer that sheds with menses. And this, the deep layer, is the one that regenerates new endometrium after menses. So the one that sheds with menses is the functional layer. The one that regenerates new endometrium, this one, it's regenerates new endometrium. Regenerate new endometrium after menses. This is the layers of the uterus. Okay. We have something called the parametrium. Parametrium is not a layer of the uterus, but this is like the refers to the surrounding tissue. So this one, it refers to the tissues surrounding the uterus. So this one, guys, it's does not constitute like a uterine layer. It's not a layer of the uterus. It's the tissue that's surrounding the uterus. This is the parametrium. So we talk again about the shape of the uterus. We talk about the parts of the uterus. We talk about the layers of the uterus. Next, it will be the size of the uterus. Size. The size of the uterus is varies with age and variety. What is the meaning of variety? Variety means how many times a woman gives birth. Variety. We have another like concept or term, gravidity. What is the meaning of gravidity? How many times a woman get pregnant? So this one, how many times she give birth, how many times she get pregnant. So the size of the uterus is varies with age and with variety. Okay. So let's go over the slides. Let me write down for you first, like the size of the uterus. So at puberty, the measurement, it will be 6 to 8 in length, 6 to 8 cm in length, and it will be 3 to 5 centimeter in transverse and interior posterior. With parity, it will grow 1 to 2 centimeter in all dimensions. And in postmenopausal patients, so the measurement, it will be 3 to 6 centimeter in length and 2 to 3 centimeter in transverse and interior posterior. So this is for the size of the uterus. So we mentioned for the size of the uterus, it's a different or varies with age and parity. At puberty, in woman with like in her reproductive years, it's 6 to 8 cm in length and 3 to 5 centimeter in width and height. So transverse, which is measuring the width, and the interior posterior the height. For like, this is like the uterus in ultrasound, we're gonna measure the length and we measure the interior posterior in stage. And I'm gonna repeat that again in, when we talk about the protocol. And we are measuring the width in transverse view. This is like the level of the fundus. We're measuring the width. So this one, we're measuring the length. This one is the interior posterior, and this one is the width or like transverse measurements. 3 to 5 centimeter in transverse and the interior posterior. With parity, it will be grow 1 to 2 centimeter in all dimensions. What that means? This means it's maybe up to 10 centimeter in length, maybe up to 7 centimeter in transverse and the interior posterior with parity. In postmenopausal patients, the uterus size will shrink and it will be 3 to 6 centimeter in length and 2 to 3 centimeter in transverse and interior posterior. Okay, what about the pediatric patients? How the size and the pediatric uterus looks like? Pediatric uterus has a relatively larger cervical length and width. So the cervix, it's a 2/3 cervix and 1/3 body and the fundus. At puberty and after menopause, the cervix, it should be like a account for 1/3, and the 2/3 it will be the body and the fundus. So this is again how like the uterus looks like with like at puberty, or how it looks like with postmenopausal patient. The size varies again, like the size with age and the body. You're gonna see the size, it will be bigger with the woman at puberty, and after menopause it will shrink in size. But when we talk about like the size of the fundus and the cervix account for 1/3, and the body and the fundus account for 2/3. With pediatric uterus, the cervix is more larger than the body and the fundus. The cervix will be 2/3, and the body and the fundus, it will be 1/3. This for the, again, if we talk about like the uterus, you wanted to know the shape, the parts, layers, and the size of the uterus. Next, it will be the uterine positions. Uterine positions. This one is normal variance. It's not a pathology. So it's variance in uterine positions. For uterine positions, we have the anteverted uterus. Let me. So this one will be the anteverted. So this one, it's a forward placement of the uterus. And the cervix. Then we have the retroverted uterus, anteverted. Let's do the anteflexed first. So this one is the anteflex. So this one, you're gonna see the uterine fundus, pens, on the cervix. So uterine positions. We have the anteverted uterus, and this one is the most common uterine position. For uterine positions, again, this one is normal variance. Anteverted, this is the most common uterine positions. You're gonna see the forward placement of the uterus at the cervix. Look here, guys, how the fundus, this is the body, and forward, it's toward, look here how it's tilt forward. It's a forward placement of the uterus at the cervix. If we do like a line here between like the vagina and the cervix, you're gonna see it's forming like a 90-degree angle. It's forming like a 90-degree angle from between the vagina and the cervix. Vagina and the cervix, they forming like a 90-degree angle. And this is the anteverted uterus. Anteverted uterus, see how the urinary bladder, it's covering like the dome of the fundus. This is for anteverted, the most common, it's a forward position. It's a forward placement of the uterus at the cervix. Vagina and the uterus at the level of the cervix, forming a 90-degree angle. What about the antiflexed? Antiflexed, it's bent or flexed toward the bladder. Look here, anti. So anti means forward, and flexed, it's bent. So uterine fundus bend on the cervix. You see how it's tilted and it's toward the bladder. And the bladder here, it will be empty. So sometimes the bladder and the rectal distension, it will affect the uterine position. In this condition, the antiflexed, you're gonna see an ultrasound, the uterus looks like that. It's flexed and bent toward the bladder when the bladder is empty. When the bladder it started to fill in, you're gonna see like the fundus, it will be like, and the body, it will move this way and it will be anteverted position. So this one for the antiflexed. Next, it will be the retroverted and retroflexed. Retroverted, and then we have the retroflexed. So this one is retroverted and the retroflexed. So retroverted, tilting backward of the uterus at cervix. And this one is oriented more linearly in relationship to the vagina. And the retroflexed uterine fundus or body is curved backward on the cervix. This is retroverted uterus. Do you remember the anteverted, how it looks like? This is the anteverted. Let's compare between the anteverted and retroverted. Remember the urinary bladder? And this is anteverted, how the fundus and the body, it's a forward placement, right? Forward placement of the fundus and the body. For retroverted, look here, the fundus and the body, it will go like tilt backward, away from the bladder. Look, this is how the fundus and the body, it's a tilt backward. It's away from the urinary bladder. And you're gonna see in retroverted uterus, the fundus and the cervix and the vagina, it's in line. Look here, it's aligned. It's forming a greater than 90 degree. This is for the retroverted. What about the retroflexed? Retroflexed, you're gonna see the uterine fundus or body is curved backward on the cervix. So again, look here how the fundus and the body, it's sharply going more posterior, more down. This is for the retroflex. It's going backward and it's sharply going down away from the urinary bladder. So this is the retroverted and the retroflexed. And we have the anteverted and the anteflexed. If you like compare between the four positions that we have now, you're gonna see the cervix, it will be located in the same place for each one. The cervix is the cervix at this area because the cervix is not movable. Remember when we mentioned the isthmus is the most flexible part of the uterus, and the uterus may bend interiorly or posteriorly at the level of the isthmus, but the cervix, no. The cervix is firmly supported. It's fixed in position because we have two ligaments hold the cervix in position. So again, if you see this normal variance in uterine positions, the uterus bend maybe toward the bladder in forward placement or maybe posterior away from the bladder at the level of the isthmus. The isthmus is the one that movable and the most flexible. The cervix is not movable. Okay, so this one, it will be like in retroverted, it looks like it's a straight line. The retroflexed, it's going sharply down or more posterior. This is for the uterine positions. We have another two positions, which is the, you don't have it in your slide, so please write that down. You have the dextro version and the levo version. Dextro version and we have the levo version. For dextro version, the entire uterus tilt to the right, and levo version, entire uterus tilt to the left. Dextroversion, the uterine position, it should be like in midline. But sometimes the uterus will be tilted toward the right or tilted toward the left. Levoversion, LL, so toward the left. Dextroversion, the entire uterus, it's tilted to the right. This is for the uterine positions. So let's read from the slides. So we're done with the parts of the uterus. Then we have the layers. We have the perimetrium, serosa, and this one is the outermost. We have the myometrium is the middle layer. We have the endometrium, the innermost and the functional layer. And we mentioned for the endometrium, we have one functional and one deep or basal layer. The one that sheds those menses is the functional layer. Uterus shape and size varies with age and OB history. Barrier to menarche, it's cylindrical and narrow, and the mature uterus and the corpus and fundus enlarge. After menopause, it's regress and shrink in size. And then you have the nulliparous female, the sagittal, it will be less than or equal to 8 cm, transverse up to 5 cm, and the interior posterior is equal to 30 centimeter. Variants in uterine positions, we have anti-flexed, anti-verted, and uterine fundus and corpus tilted forward. We have the retroflexed, corpus and fundus tilted posteriorly, and then we have the retroflexed and retroverted corpus and fundus and cervix are tilted posteriorly. And this is one showing you the variants in uterine positions. If you look here, this is how this is anatomy. Look here is the uterus is located between the urinary bladder and between the rectum. And when the uterus in forward placement, this one is called the antiverted. Look here for anti-flexion, how the fundus and body it's flexed in forward position toward the bladder. So look here, guys, this area here, this is the pubic symphysis. And this one is the bladder, uterus, rectum, spine. In retroflexion and retroverted, look here in retroverted, how it looks like in a straight line. The vagina and the cervix and the fundus and body in a line or a straight line, forming angle greater than 90 degrees. And see how the uterus, which is fundus and the body away from the bladder. See here how for retroflexion, how is the fundus and the body, it's bent or it's flexed more posterior toward the rectum. This one is retroversion and retroflexion. This is the variance. Again, guys, this is variance. It's not a pathology. For ultrasound, the appearance, the uterus myometrium, remember we cannot visualize the superficial layer or the serosa on ultrasound. We see the myometrium and the endometrium. It's a mid-gray or medium level echoes. It's a homogeneous texture and pattern. It's a smooth, even contour. For endometrial cavity, we mentioned this one, it varies in thickness in relation to the menstrual phase and also varies in ultrasound appearance. Here it sits thin echogenic line. One of the phases of the menstrual phases, you're gonna see the endometrium thin echogenic line, but not all the time. And again, we're gonna explain and know more details about the endometrial ultrasound appearance in relation to the menstrual phases later in lecture number 3. Vagina, it's mid-gray to medium level echoes, and vaginal canal is hyperechoic or echogenic line. This is how the uterus looks like in ultrasound, the one that I drew for you on the board. See how the bladder, this is the bladder. We use the bladder as acoustic window. It's a cystic structure with posterior acoustic enhancement. It's enhance the pelvic organs. Look here, the orientation, interior, posterior, superior, inferior. Look here, the most superior and the widest part, the fundus. And then we have, this is the body, this is the cervix area, this is the vagina, and this thin echogenic line, the vaginal canal, and this echogenic area here in the middle, this one represents the endometrium. Another ultrasound image, if you look here for in the urinary bladder, you're gonna see reverberation artifact. You can get rid of this reverberation artifact when you change the window. This is the fundus, this is like the cervix area, this is the endometrium. Do you see there is a hypoechoic halo surround the endometrium? There is part of this hypoechoic seen here, hypoechoic halo. This one represents the junctional zone, which is the inner portion of the myometrium. This one, it's represent the retroflexed uterus. Look here, guys, the vagina, and this is the cervix area, and see how the fundus and the body, it's sharply going more posterior, away from the bladder. See how this is the uterus, this is the fundus, and the body is going sharply posterior. Remember the orientation, interior and posterior, superior and inferior. Look here how the body and the fundus is tilting away from the bladder, sharply down. This is retroflexed uterus. This is the transabdominal pelvic exam. You're gonna see the bladder, and this is a cross-sectional of the uterus. You see this is the uterus at cross-sectional. And for orientation and transverse, we have the interior, posterior, right, and left. And we are going to talk about this one in lecture number 2. For the next, it will be the fallopian tubes parts. We have 4 portions. We have the interstitial, we have the isthmus, we have the ambula, and we have the infundibulum. Let's talk about the fallopian tubes parts. I'm gonna show it to you. Fallopian tubes, also known as salpinx or oviducts, and it's a length. It's a 7 to 14 cm, and it's divided into 4 parts. So if this is like the fundus here. So number one, we have the interstitial. And this one is the segment that passes through the uterine hormone. Do you remember we mentioned we have the, this is like the fundus, and at the lateral side of the fundus we have the cornua, right? And the cornua where the fallopian tubes enter the uterine cavity. Look here guys, this is the endometrium and of the uterine cavity, and the fallopian tube enters the here at the level of the end. This is called the interstitial part, this one here. This is the interstitial. The interstitial is the segment of the fallopian tube that passes through the uterine cornua, this one here, that enters the uterine. This is called the interstitial part. Then we have the isthmus. The isthmus, this one, the isthmus is the medial segment. So the isthmus is it's very narrow, and it's the medial segment, this one here, medial. Then we have the ambula. The ambula. And the ambula, look here, this is the ambula. The ambula, it's the longest. Let me write it down for you. It's important. Ambula. This one is the middle segment. And the ambula is the longest. And the widest. And the most coiled. And the most tortuous portion of fallopian tube. So ambula, this is the ambula. You see how it's, this is the middle segment, is longest, is widest, is coiled, and tortuous. And this is the ambula here. This is the ambula. Guys, ambula, it's the site of fertilization. Ambula is the site of fertilization, and also is the most common location for ectopic pregnancy. Again, ambula is the middle, is the longest, widest, coiled, is the most tortuous, and it's a site of fertilization and the most common location for ectopic pregnancy. And then we have the infundibulum. This one is the infundibulum. Let's try to. The infundibulum. This one here, this area here, this is the lateral, right? Imagine this one is the fallopian tube, my hand here. So this one is the infundibulum. Look here, it's the lateral portion. So this one is the lateral, and it has like finger-like projections. And this one is called the fimbria. This finger-like projections. So the lateral portion is called the infundibulum. Infundibulum. This one is the lateral portion, and it has like finger-like projections. What is the job of the finger-like projections, the fimbria? Look here. This is like the ovary. And let's say ovulation occurs. So the fimbria, it will move over the ovary, and it's direct to the ovum. This is the ovum, this is the egg. It's direct to the ovum inside the fallopian tube. And the fertilization occurs here at the level of the ampulla. Look here, this is a sperm, this is the ovum. Fertilization occurs here at the level of the ampulla. So it's a move over the ovary and direct to the ovum. It's a direct the ovum inside the fallopian tube. Fallopian tube in ultrasound, we cannot visualize the fallopian tubes in ultrasound if it's normal. If it's inflamed or there is any pathology, you can see the fallopian tube. But in a routine, like exam, pelvic exam, and it's normal, we cannot visualize the fallopian tubes. What are the layers of the fallopian tubes? The layers of the fallopian tubes is the same as the layers of the uterus. Layers of fallopian tubes. We have the serosa, we have the muscular layer, and we have mucosal. Do you remember in layers of the uterus, we have the perimetrium, myometrium, endometrium. Metrium, it's represent the uterus. So I can't say with the layers of fallopian tube metrium, because metrium means uterus. So I can say serosal layer, muscular layer, mucosal layer. So this one there, muscular layer, and the mucosal layer. And the fallopian tube are not routinely visualized on ultrasound. Fallopian tube can be seen only when it's inflamed or there is any pathology. This is for the fallopian tubes. I'm gonna stop here, and I'm gonna, this is like for lecture number 1, part 1, and I'm gonna record for you another video for the rest of the lecture. Have a good one.